Hi everyone, my name is Adelani Oluwatobi. I work here in First Cardiology Consultant in the cath lab. Today I'm going to be talking to you about pacemakers, how it works, who needs a pacemaker, and everything that planting a pacemaker here in First Cardiology entails. Okay, so what is a pacemaker? So here in my hand I have a small prototype of what a pacemaker is. So a pacemaker is a small cardiac implantable electrical device that we implant near the collarbone to help regulate abnormal heart rates, abnormal heart rhythms. Okay, so patients who have abnormal heart rhythms and that are symptomatic are the ones we actually put in a pacemaker in. So there are conditions that can necessitate a patient coming for a pacemaker implant. Patients with complete heart block. There are other types of heart block that might also occur that would make a patient come for a pacemaker implant. But mostly these patients will feel symptomatic. They'll feel breathless, tired. They will not be able to do their normal activities. Even climbing up the steps, up the stairs might be a very, very difficult medical test. Patients that have sick sinus syndrome, also, this is what we call the tachybrady syndrome, where the heart rate can go so slowly, and the patient might want to pass out or just fall down flat while doing any activity at all. So patients with these symptoms, with these conditions, are actually the ones that needs a pacemaker implant. But before they come into the hospital, there are certain tests we do to ascertain that they need an implant. These tests are the necessary requirements that actually needs to be done. Tests like ECG. Also, we do a 24 to 48-hour Holter to ascertain that patients really have the symptoms and they need to get an implant. We have a single chamber pacemaker. We have a dual chamber pacemaker. We have a biventricular pacemaker, which is a CRTP. That's the cardiac synchronization therapy pacemaker. And let me say this: pacemaker is a type of cardiac implantable electrical devices. We also have other types of cardiac implantable electrical devices, which are the BCD, implantable cardiac defibrillator. We have the CRTD. The CRTD is the cardiac synchronization therapy defibrillator. So these are other types. But here in this video, we are basing our explanation on the pacemaker. Also, the pacemaker is not a major surgery. It's a minimally invasive procedure. Minimally invasive meaning that we are not cutting you open. So we are just going under the skin. Okay, so we implant the device just near the collarbone. So what we do is that we make an incision just around the collarbone to create the pockets where the device is going to sit in. And also, where we implant the lead, we use a percutaneous access from the subclavian vein, where we put in the lead and connect to the pacemaker. So it's not a major procedure. It's a procedure that takes about 1 hour to 30 minutes. 1 hour 30 minutes to 2 hours thereabouts. Just the preparation and all that. But the procedure itself doesn't take long. And you just need a 1-day stay in the hospital. After we've done the procedure, we'll admit you into our ward just to monitor you over the night. And by tomorrow, you do your X-ray to be sure that the leads are intact. And in the afternoon of the day after your procedure, you're already home. So it's not a major procedure and doesn't require a long-term stay in the hospital. Very importantly, pacemaker checks post-procedures are very, very important. We want to ascertain that the pacemaker is actually suitable for you. You want to ascertain that all the lead parameters, the pacemaker parameters, are optimal functionality. We want to be sure that the pacemaker is sensing and is pacing. We want to be able to carry out certain tests after the procedure. just to ensure that the pacemaker is working fine. So we give you periodic appointments. We give you an appointment a week after your procedure, a month after, 3 months after, then once a year, just to ensure that your pacemaker is working optimally. Yeah, so the pacemaker has a lifespan. It's a battery. It has a lifespan. The minimum lifespan for a pacemaker is it depends on the usage of the patient. It depends whether the patient is dependent or not. If the patient is dependent on the pacemaker, that means the pacemaker is working every time. So, but nevertheless, the minimum years is the minimum, at least, longevity of the device is between 8 years, depending on usage. But it shouldn't be less than 8 years. But other devices, some other patient, depending on the kind of patient it is, some can use 10 years. Some brands, some new pacemaker brands, can use 12 to 15 years, but minimum is 8 years. The pacemaker has components. This is the header, this is the pulsator, this is the implantable pulsatile generator. It's connected to what we call the leads. The leads are the ones that send electrical signals to the pulsatile generator. And the lead also has electrodes. These are the parts of the pacemakers that bites the muscles of the electrical chambers. So what the pacemaker does is that anytime a patient's heart is beating too slow, what the pacemaker does is that it senses this and then sends electrical signals to the pulsatile generator to send electrical impulses back to the heart muscles to pace the heart in such a way that it increases the heart rate depending on how the basal rate will set it up. So normally when the patient comes in, there are certain programmable details. We set up instructions. We set in the pacemaker. So we program a base rate of 50 beats per minute or 60 beats per minute, depending on how it will be suitable for the patient. So the pacemaker senses anytime the heart rate beats so slowly, or anytime there's an abnormal heart rhythm, and it fires back impulses to this pulsatile generator so that it sends electrical impulse back to the heart muscles to increase the heart rate or to correct the anomaly. So that's how the pacemaker basically works. It's a safe procedure, and we've had about 99 to 100% success for all the implants we've done so far.